Let's talk about the silent commander in your neck. It's this tiny butterfly-shaped gland, but it has a huge job. This is your thyroid, and it's basically the master controller for your body's energy and metabolism. You know that feeling when you're just completely exhausted for no reason? Or maybe the opposite, you're so wired and anxious that you just can't seem to relax. It might not be stress or a bad night's sleep. The surprising culprit could be this small but incredibly powerful gland. All right, so before we dive into what happens when things go wrong, we got to understand how the system is supposed to work. And honestly, the best way to think about your thyroid is like the thermostat for your body. It's constantly fine-tuning your energy to keep everything running just right. So here's the chain of command. It all kicks off in the brain with the hypothalamus. It sends a little message, that's TRH, to the pituitary gland. The pituitary then releases the key signal, TSH, which stands for thyroid stimulating hormone. You can think of TSH as the messenger that basically tells your thyroid, hey, time to get to work. We need those hormones that fuel the body's metabolism. And here's where the system is just so smart. Once the thyroid produces enough hormones, mostly T4, which then gets converted to the more active T3 hormone, those hormones circle back to the brain. And they pretty much say, okay, we're good. You can turn the signal off now. It is a perfect negative feedback loop, exactly like a thermostat shutting off the furnace once the room hits the right temperature. So, what happens when that thermostat breaks? Well, this is where we get the two main types of thyroid problems. You can think of it as the whole system getting stuck, either stuck on low or stuck on high. First up, we have hypothyroidism. Now, hypo just means under or too little. So in this case, your thyroid isn't producing nearly enough hormone. And the result? Your entire body's metabolism just slows right down. It's kind of like an engine that's idling way too slowly. And on the flip side of that, you've got hyperthyroidism. Hyper means over or too much. Here, your thyroid is in complete overdrive, just pumping out way too much hormone. This sends your metabolism into high gear, almost like an engine that's just revving totally out of control. So to put it really simply, using our analogy, with hypothyroidism, the thermostat in your brain is cranking up the signal, but the furnace, that's your thyroid, is broken and it just can't produce enough heat. With hyperthyroidism, the furnace is stuck on high, just blasting heat nonstop no matter what the thermostat is telling it to do. So what actually causes the furnace to break or get stuck like that? Well, in most cases, it's actually the body's own immune system. It gets confused and starts attacking the thyroid. For hypothyroidism, the most common reason is something called Hashimoto's disease, where the immune system just slowly destroys the gland. And for hyperthyroidism, it's usually Graves' disease, where the immune system actually tricks the thyroid into overproducing hormones. You know, since the thyroid controls the metabolism of your entire body, it totally makes sense that when it's not working right, the clues, the symptoms, can be felt from head to toe. And this just lays out the stark contrast perfectly. With hypothyroidism, everything slows way down. You feel tired, sluggish, you gain weight, you can't stand being cold, and your heart rate slows. With hyperthyroidism, it's the total opposite. Everything speeds up. You feel nervous and irritable, you lose weight without trying, you feel hot all the time, and your heart is just racing. They are literally polar opposites. Now, with such a huge range of symptoms, you might be wondering how a doctor can possibly figure out what's going on. The good news is they can solve this mystery with a really simple but very powerful tool, a blood test. So how do they actually decode those results? Well, they look at a few things, but there's one number in particular that tells most of the story. And it all comes back to that initial signal from the brain we talked about. And that number is your TSH level. For most labs, the normal range for this thyroid-stimulating hormone is somewhere between about 0.5 and 4.5. And that upper limit, 4.5, that's the critical threshold. The doctors are watching very, very closely. This table right here puts it all together beautifully. Okay, think about it. If your thyroid isn't making enough hormone, that's your low T4, your brain's thermostat screams for more, right? So your TSH goes high, way above 4.5. But if your thyroid is making way too much hormone, that's high T4, the brain goes, whoa, whoa, turn it down, and it shuts the thermostat off. So your TSH goes low. It's this inverse relationship, and once you remember that thermostat analogy, it all just clicks into place. Okay, so maybe the best part of this whole story is that once a thyroid disorder is actually diagnosed, it's very treatable. The entire goal is just to restore that delicate hormonal balance that the body has lost. For hypothyroidism, the logic is incredibly simple. If your body isn't making enough thyroid hormone, well, the treatment is to give it back. This is done with a daily pill called levothyroxine, which is just a synthetic version of that T4 hormone your body is missing. It's basically just topping up the tank. Now, for hyperthyroidism, the goal is the exact opposite. We need to slow down that overactive gland. And there are a few ways to do this. You can use medications that block the hormone production. There's a specialized treatment using radioactive iodine to reduce the gland's activity, or in some cases, even surgery. The key thing to remember here is that for most people, these are chronic conditions. They're going to need lifelong attention. But the really good news is that with the right diagnosis and consistent treatment, they are highly manageable. People can live completely normal, healthy lives. It's pretty incredible when you think about it. This one tiny gland acting as the silent, powerful energy switch for our entire body. It's just a good reminder to pay attention to those subtle signals your body sends you. So the real question is, are you listening?